Do you suffer from knee pain? Imagine walking through life in comfort again. The new Flex OA Comfort Footwear Collection from Dr. Comfort can help change the way you move and let your natural foot motion reduce your pain. Created in association with Rush University Medical Center, Flex OA was designed specifically to reduce knee pain associated with osteoarthritis, or OA. Flex OA uses patented new X-Sole Relief technology, proven to reduce the load on your knees.
Doctor, tell us about your affiliation with Rush University.
I'm a podiatrist, and I was actually recruited by Rush University to come and assist in the investigation of medial knee osteoarthritis. Medial knee osteoarthritis is the most common form of osteoarthritis in the United States. There are over 30 million people in the United States with this form of arthritis.
So I'm a rheumatologist. I take care of patients, and then I also spend a great amount of my time doing clinical research. And my clinical research focuses osteoarthritis and biomechanics in osteoarthritis. So how forces that we put on our joints when we're walking can affect osteoarthritis progression and pain and symptoms over time. We know that we don't really have a cure for osteoarthritis. So eventually, as osteoarthritis progresses to end stages, the only real cure is a joint replacement. So for years, shoes have been engineered for the feet. We have made shoes to provide comfort to the feet. And really, nobody really thought about the fact that our whole lower extremity is connected. Our foot's connected to our knee and to our hip, so anything we put on our feet obviously probably affects the rest of us. So it's just recently that we really started paying attention to what our shoes are doing to our knees, especially when it comes to something important like osteoarthritis, where that sort of stuff would be very important.
The Flex OA shoe works by actually trying to allow normal motion to occur. If you think about walking, okay, your foot has to go through certain amounts of motion at certain times in the gait cycle. So what the Flex OA shoe does, it actually puts flexure zones in the outsole of the shoe and tries to allow the foot to go through its normal motion, therefore allowing that motion to occur and not restricting any of that motion.
This is how this shoe sole came out. We started thinking, well, perhaps natural movement, barefoot-like movement, the natural flexibility and gracefulness you get of your foot touching the ground is beneficial for us. And with modern footwear that's out there right now, we were losing that, actually. And so that's where this design came. So now this new sole design has these cuts in its sole that allow you to walk very naturally and very gracefully. So most of our participants loved being in the study. They loved getting the shoes. They thought right away that the shoes felt really comfortable and lightweight, and most of them didn't want to give the shoes back when they were done with the study. So they really seemed to like the shoes, and overall they really seemed to think that the shoes had changed how they felt in terms of their arthritis.
Well, the Flex OA actually reduces loads across the knee, and it's those compressive loads that cause the osteoarthritis. So instead of having joint destruction down the road, essentially just by simply putting a pair of shoes on, you can push that joint destructive phase farther and farther away.
We've shown that in our studies, people wearing these shoes over 6 months have a significant reduction in their knee load, 20% over 6 months. That's a huge reduction. And so we believe that with this amount of reduction in your knee load, you'll have less pain over time and less progression of your arthritis over time.
Flex OA gives you a new world of motion, a world that's yours to explore, where your natural motion actually reduces pain. Free motion with less pain. Try Flex OA and let your natural motion reduce your pain.
So, Dr. Shakur, the knee bone is connected to the shin bone.
You could say that.
Can you sing us that song, Doctor?
I don't think so.
I can't sing the song.
The foot bone's connected to the shin bone.
The shin bone's connected to the hip bone.
Through the process of direct linear transformation, we can actually calculate the three-dimensional forces inside of the knee joint.
The shin bone's connected to the knee bone, and the knee bone's connected to the hip bone.
The calcaneus is connected to the talus.
And the foot bone's connected to the ankle bone.
The talus is connected to the tibia. Tibia is connected to the... Wait a minute, where's it go next?
How's the song go?
So again,
And I think the knee bone's probably eventually connected to the hip bone.